Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Dr. Don Buckner, who is the CEO and Medical Director of Meridian Behavioral Health. Welcome to our program today, Dr. Buckner.
Well, thank you.
We are so glad to have you here with us today. And just a little background here. He is the past president of North Carolina Psychiatric Association. He actually studied at my alma mater for his undergrad in chemistry at North Carolina State University, go Pack, we might say. And then he went down the street to Chapel Hill to the University of North Carolina, where he got his doctorate in medicine. So we'll overlook that last little part there along the way, and we are certainly glad to have you here today on the program. Dr. Buckner, why don't you talk just a little bit and tell us about the organization? What is Meridian Behavioral Health?
Sure. Well, I love talking about Meridian. Meridian's near and dear to my heart. Meridian's a nonprofit agency that provides behavioral health and substance use services to both children and adults here in the western counties of North Carolina. Essentially, if you look at the map, Buncombe, Transylvania County West, we're providing some type of service in each of those counties. We serve individuals regardless of their ability to pay. We have some support to provide services to folks that are between jobs without insurance, and we take all forms of insurance. So really proud that we're able to do that, and that the community supports us in that. We have really focused our organization's culture around the culture of recovery. We feel like every individual we serve has the ability to participate in their care and in their own recovery and set their own goals for their treatment, and also focus on resilience. We know that many individuals have gone through difficult times in their lives, different kinds of challenges or traumas, and folks need support in knowing how to get through those times and build their skills to manage the challenges that life is bringing their way. So we're real proud of that culture that we have at Meridian.
Dr. Buckner, I can only imagine that this year you've seen the need for resilience to grow even more for people, as we've just faced so many different challenges in 2020. So it's really powerful that you work on this culture of recovery and that resilience is such a focus. Has 2020 brought some changes for what you've seen relative to those that you're serving?
Well, absolutely. I think most people can identify with that to some degree. There's different ways this manifests for individuals. For some, it's anxiety, it's worry about their own health, worry about the health of others, and it may be worry about loss of job or loss of income. Some people are worried about loss of housing or other securities. So for some individuals, it affects their mood. Some individuals struggle with depression through this. Isolation is something that is affecting a lot of the folks that we serve. And we know that connection to the community is so critical for folks, connection to family. And a lot of individuals don't have that right now. And we certainly are seeing the results of that in the individuals we serve and, in the communities around us.
I can imagine that probably everyone who watches this program, we can all relate in some way, shape, or form to something that you just went through on that list of the ways that things manifest for each of us as individuals. How has the grant that you received from Pisgah Health Foundation, how is that helping you to serve Western North Carolina?
Well, the grant from Pisgah has supported one of our programs that's called our Supported Employment Program. And supported employment it's an evidence-based program, and it serves adults who have a mental health diagnosis And what it does is it helps individuals toward a goal of employment. We know that 60 to 70% of individuals who have some type of mental health diagnosis want to work. And it could be that their symptoms make it difficult. It may be that different circumstances that have happened to them have made securing or keeping a job difficult. So this service is designed to essentially equip people to get back into the workforce. And it can do things such as connect people to educational resources, can do simple things like helping them prepare a resume, practice for job interviews. The program also works with employers to find employers who are open to having someone work for them that may have a struggle with anxiety or with depression. And we're always, I shouldn't say surprised, but it's always encouraging to find those employers who really have a heart for this and realize that many of us go through times in our life where we have these struggles and we just need some help getting back on our feet or back in the workforce. So we this program is, essentially to help our folks get back into the workforce. And this grant is helping us fund this program. Unfortunately, it's a program that's seen some challenges in funding, and we've had difficulty paying our staff a reasonable wage to do this work. And it's the ironic thing is the individuals we've had working in this program often find better paying jobs than working at Meridian to do this. So we realize we've got to come up with some strategies, and this grant's allowed us to do some of those things. For instance, how to provide some incentives for our staff when our staff are able to achieve some successes, help the individuals they're working with find a job. And we've got some pretty cool ways to reward our staff. And it's not big money prizes, but it may be a Starbucks gift card. It may be some small things like that. But our staff have just been really appreciative of that and some of the things that this grant has allowed us to do, and other supports that the grant has allowed to this program, and allowing us to be in a position where now we can hire some additional people to do this work, because it's a real need in our communities. Many folks have been out of work, and they may have a struggle that's keeping them from entering the workforce again. So we're able to provide some help to them.
The program certainly sounds incredibly meaningful, and I'm really glad that this grant has been able to help you in finding ways to keep it going. And I applaud what you're doing to say, what do you need to do to keep it moving forward? Because, as you stated, the need there is very, very real. It's such a relevant area of helping people in that culture of recovery, just getting back in and having gainful employment and finding purpose in that employment along the way. Dr. Buckner, what else would you like our viewers to know about you and the organization? How can they come alongside you, get involved? Where can they find you?
Sure. Well, we want to let people know that we are open, first of all,
Wonderful.
and COVID has not caused us to close our doors. We're still offering the majority of services that we were offering before before the pandemic, and people are able to contact our outpatient offices and schedule an assessment. They can have that assessment done remotely via Zoom or another video method. And they can find us by different ways. You can go to our website, which is Meridian BHS for Behavioral Health Services.org. And there you can find the numbers for the local office. We have outpatient offices in Brevard, in Waynesville, in Franklin, and in Silva. So you can call, schedule an intake, and enter in the services, and we can help you determine what might be the best service that would be available. We also work with other community partners to find support for our work. Unfortunately, behavioral health services have seen reductions in funding over the last several years. So we've had to stretch our dollars further, and we're really reaching out to foundations for support and individuals who are providing some support, and that can go a really long way. So if anyone would like to find out more about Meridian, just go to our website and you can learn other ways to support us.
Well, thank you and the organization for staying open through all of these times. And while it sounds like the dollars and support has dwindled over the recent years, I can only imagine that the need for what you're doing there with behavioral health and is actually increasing. And so thank you. On behalf of the Board of Directors of Pisgah Health Foundation, I would like to say a personal thank you to you, to your staff, and the others who are doing so very much to help people in this space of behavioral health and substance abuse. It's not always a fun place to think about and talk about, but how important and special and meaningful it is. And so thank you very, very much. And thank you for being a part of today's program.
Well, thank you for this opportunity, and we're so thankful for the Pisgah Health Foundation and for the support for this really exciting program. And when we see the results of it, it's very exciting.
Wonderful. Making an impact. Thank you so very much for that, Dr. Buckner. We also want to thank Wildflower Media for their creative and technical support in bringing this program to our viewers, as well as to thank the Board of Directors and the staff at Pisgah Health Foundation and the Physicians Roundtable. Until we see you on the next Pisgah Health Today, stay well and be well.